Greetings, my name is JRobinson, and I will be presenting Program Evaluation, an analysis of two evaluation models for EDSI 9171 at the University of West Georgia. The following presentation compares and contrasts two models of program evaluation in regard to their appropriateness for the fictional Rural Parental Support, or RUPAS, program. Initially, I will provide a review of evaluation and evaluation approaches before going on to provide an overview of the two evaluation models. After analyzing each model, I will determine the suitability of each model for the RUPAS case study based on the characteristics of the case study and the primary components of the aforementioned models. As program evaluation has developed, scholars have organized the various approaches into 5 categories: pseudo-evaluation, quasi-evaluation, improvement and accountability-oriented, social agenda and advocacy, and eclectic. For the purposes of this presentation, I will discuss the improvement and accountability-oriented and social agenda and advocacy groups. Consumer-oriented studies emerge heavily from values, needs, and costs. Their purpose is to comprehensively determine the merit of products and services so that stakeholders can make educated decisions between viable options. The strengths of this program lies in its objectivity, and because of this, consumer-oriented studies are regarded as having a high level of credibility. Its weaknesses concern the fact that stakeholders are not extensively involved in the process, and therefore key elements or concerns may not be addressed. The consumer-oriented approach utilizes an external evaluator who scores the program based on its ability to meet program objectives, and this culminates in a compressed judgment of the program's merit based upon Scriven's general logic of evaluation. The pioneer of this format is Michael Scriver, who developed the consumer-oriented approach and first coined the terms formative and summative evaluation. In contrast, the deliberative and democratic evaluation is based upon participation, dialogue, and deliberation to determine the merit and worth of a program. Its purpose is to employ democratic participation in the process of assessing a program. This approach should be used when the concerns of the stakeholders are a primary focus. Accordingly, the funding agent has to provide consistent updates throughout the process and frequent opportunities for stakeholders to be involved in evaluation. The weakness of this method is that full stakeholder participation is difficult to acquire and impossible in some circumstances. The strength of this approach is that due to stakeholder involvement, there is respect for the findings and a greater opportunity that the results will be used. In the deliberative and democratic evaluation approach, stakeholders are intimately involved in this process at every stage, extending from inception to presentation of findings and the final discussion of results. The pioneers of this approach are Kenneth Howe and Ernest House. These scholars created the deliberative and democratic evaluation from components of numerous other works and incorporated the values of other researchers into this paradigm. The primary purpose of the RUPAS program is to assist parents in rural areas with stimulating their children cognitively. The program directors for Family Matters are seeking to complete an evaluation on the program that is cost-effective and appropriate for leadership that is not familiar with the evaluation process. The primary difference between the two approaches lies in their purpose. Consumer-oriented studies are designed to compare the merit of a program so that an intelligent decision can be made about one or more options. The deliberative and democratic evaluation seeks to improve the program through dialogue with all stakeholders. Considering the RUPAS case, the program outcomes are not clearly defined, which would affect the checklist and scoring aspects of the consumer model. Language and distance barriers may affect both models, but with the dialogue-heavy deliberative model, adjustments need to be made for the difficulties that would occur trying to converse and reach the various stakeholders. Both models will result in high levels of credibility. However, the consumer model has a greater potential for an irrelevant evaluation because important perspectives can be excluded. Clearly, there are costs and benefits to both approaches. The children, Family Matters program directors, parent trainers, migrant population, and parents themselves are all key stakeholders in the RUPAS case study. The only approach between the two being examined that can successfully incorporate all of these voices is the deliberative approach. Although there are concerns about implementing this process effectively, Chambers 2003 believes that engaging in the process itself will provide support for program evaluation, even though all of the tenets of the program are not fulfilled successfully. With the various stakeholders in the RUPUS program, consumer-oriented studies are not an effective way to incorporate the voices of this diverse group. Even when the model is implemented successfully, researchers have found that there were barriers in their attempts to gather data from other downstream consumers, as noted by Xiong, Wineski, Enderbitson, and Campbell, 2013. Despite this lack of input, the researchers were still able to complete the evaluation, suggesting that there were some degree of inaccuracy in the final report. In conclusion, the deliberative and democratic evaluation model would be the most appropriate approach to use in the RUPUS case study because its design supports the various stakeholders' perspectives while protecting against bias. While the deliberative and democratic evaluation model presents difficulties in regard to scope and implementation, it can be utilized to promote program improvement.